Hi, I'm Dr. Will DePaolo. Today I want to take us into a sort of deep dive into the world of probiotics. Today I want to talk less about the types of probiotics or the strains that are beneficial or how to choose a probiotic. Today what I want to talk about is more the science behind and the research that's been done to indicate whether or not probiotics are actually beneficial to those people who are healthy and to those who have certain conditions or diseases. So let's jump right in. Walking into a grocery store nowadays, you probably can't help but find a million products that have some sort of probiotic or prebiotic that are associated with them. Before, it used to be that these were relegated to the health section of the grocery store, the supermarket, but now it's in every aisle. You find that there are probiotics added to fruit juices, sausages, granola bars, even pet food, cookies, you name it. Probably there's a probiotic in it. This includes beverages like fruit juices and waters with probiotics. And this has now stretched from things we consume to other products like skincare and cosmetics. So these industries are jumping on the probiotic bandwagon, adding bacteria to lotions, shampoos, etc., in order to tap into that consumer market. Companies are also offering an analysis of your gut microbiome, and then using that data that they get from your stool sample, they will push or promote their own brands of probiotic supplements that they're going to tell you are necessary for your gut health because of your composition of the gut microbiome. So it's safe to say that probiotics are very mainstream now, and this is more apparent as research on the microbiome grows and more people are becoming familiar with all of these trillions of bacteria that reside within our gut and we have in our intestines. And I think that this sort of research into the microbiome has people started to reconsider the use of probiotics as a means to supplement their gut health. Seeing this public interest in probiotics, companies have really responded. I mean, you can see this in the numbers associated with the probiotic market. So just between the year 2007 and 2012, the number of people using probiotics in the United States went from 900,000 to 4 million people. That's more than a quadruple increase in the people using probiotics. And then if you look at the probiotic market, what they're predicting by 2024 is about a $66 billion market for probiotics. That's a huge number. And you can tell based on these numbers that there's a popularity and a frenzy sort of surrounding probiotics by consumers. This is probably fueled by the research and the public interest in the gut microbiome, which has really shot up over the last decade. People discuss the microbiome at the grocery store, over dinner. You can't open up the newspaper or turn on the computer without finding some sort of article about the gut microbiome. So I think it's this knowledge that we're getting and that we're seeing on the microbiome, which is a world that we're just discovering. Your gut microbiome is, your intestines are home to 40 trillion bacteria that reside in our intestines, and we're finding out every day how important these bacteria are to our health. And this has made people reconsider probiotics because probiotics live within our bodies. We have normal endogenous probiotic bacteria that contribute to our gut health. These bacteria were probably given to us by our moms during birth and then through breastfeeding, which is a big source of bifidobacteria. That is a really healthy probiotic bacteria that promotes a lot of beneficial health effects in an individual. And so we have these gut bacteria that reside in us that are probiotics. And so it's not surprising that we are looking at probiotics as a means to manipulate our own gut health. But this isn't the first time probiotics have been popular. Back when I was a postdoc, I won't even put the number out there because it's going to make me feel old, but back when I was doing my postdoc, there was a surge in probiotic research that was going on at the time. And this was when the microbiome was in its infancy, if even really very little discussed. And the research that was happening was that people were using probiotics in clinical trials, but they were not getting good results, and they weren't getting results that were comparable because people in different institutions were using different probiotics, or even if they were using the same probiotic, they might be using different strains of that probiotic or different concentrations of that probiotic to treat the disease. And so what ended up happening was you'd get multiple papers that said either conflicting things or that just didn't have any effect on the disease. And this was due to sort of a lack of communication and a lack of standardization with probiotics in research at that time. So because of this, probiotic research kind of disappeared for a while, and then the microbiome became popular, and that idea that you can manipulate your gut bacteria and that you had probiotic bacteria within your gut reawakened that sort of probiotic area of research. And now, since the microbiome is at the forefront of science, it's not surprising to see this probiotic research is also going and increasing, and we're finding more and more about the probiotics in different diseases. And so hopefully this time around people do things in a smarter, more formal, more rigorous manner in order to get these studies that can be used to give us definitive indications of probiotics in treating clinical diseases. But what about if you're a healthy individual? If you're somebody who lives a healthy lifestyle, is it going to benefit you from taking a probiotic? And that's a question that I think is really interesting, because if you're healthy, you have probiotic bacteria that live inside you, and these probiotic bacteria are functioning normally. And so if you have a good lifestyle, if you have a strong gut, you have these bacteria within you. Will you benefit from a probiotic? And I think what the science is telling us, that's from, of recently, is that people who are healthy, who don't have any chronic disease or even an acute disease, probiotics really have very little, if any, impact on your health status. They're not going to be doing a lot to change your health or how you feel. And this is due to a number of reasons. So first reason is that when probiotics are selected by companies to put into a food or to create a supplement, the strains that they choose are going to be very different than the strains that are inside your body. And so it's hard to guess what strains are best for your gut environment and which ones will help improve your health. If you think about it, all of us have a unique microbiome. Your microbiome is as unique to you as a fingerprint. And these gut bacteria have lived with you since birth. These probiotic bacteria have lived with you since birth. And so they've experienced everything you've experienced, from your childhood to relocations to traumas to your different diets and food and all of that stuff. And so they've tweaked their own biology to live inside you, to thrive inside you. And so you're asking a probiotic supplement to also compete with these bacteria that have lived with you forever. It's really asking an outsider to come in and create a life for themselves in an environment that is really not permissive to them at this point. And so this ecosystem of bacteria that you have inside your intestines is going to make it pretty difficult for anything that is, sort of an outsider to come in and colonize. And so it's not going to be very hospitable for those strains of probiotics. And so that idea of picking strains that are right for you is the first hurdle in having probiotics affect a healthy individual. And then if we think about the numbers, there's 40 trillion bugs in your intestine. That's a huge amount of bacteria. And you're asking a probiotic which has something like 1 million CFUs or maybe 1 billion at the most to get in there and compete with 40 trillion bacteria for space and nutrients and to find neighbors that they would be able to interact together well. And I think that's a big ask as well. And so not only do you have the fact that there's an environment that's an ecosystem that's a well-oiled machine with lots of components and inhabitants, these probiotic bacteria are also going to be the number that in your supplement or in the food that you're eating is going to be diminished by the stomach acids. And so the numbers are not even going to be quite as high as what you're taking. So, these bacteria have to get through your upper respiratory, upper GI tract through your stomach, and then get into the small intestine or to the colon, and then find a space for itself to colonize. And so this, just the numbers in and of itself are going to be reduced before they can even find a spot that they could be able to colonize. So you're reducing these numbers of bacteria already due to having to get through your GI tract. And then you have this whole environment that's already well established that you're trying to get these probiotics to find a spot that would allow them to grow. This is a huge hurdle in having probiotics really work for a healthy individual. And so if your gut is healthy, working, and functioning, there's probably not going to be much room for these guys that you're adding to your bodies. And so they're probably going to just pass right through you. Now, the last thing I want to bring up here is that there's also an idea that people are either responsive to probiotics or non-responsive to probiotics. So there's been 2 studies that have been done. One involving 23 people, healthy individuals who were given a probiotic that contained all bifidobacterium, and they were then given the probiotic for a certain amount of time, and then it was discontinued, and then their gut microbiome was sampled months afterwards. And out of those 23 individuals, 7 of them still had the bifidobacterium in their stool samples 5 months and more out after they discontinued the use of that probiotic. That meant that 7 of these people were somehow had a gut environment that was permissive to this bifidobacterium getting in there and colonizing. Now, if they used a different probiotic, if they would have used lactobacillus, would it have been the same 7 people that would have lactobacillus in their stool samples 5 months out? We have no idea, and I bet it's probably not. There's something about that combination of an individual and the probiotic, the species of bacteria, that were working together. For some reason, these 7 people had an ecosystem that was permissive to that bifidobacterium to getting in there and colonizing and creating a habitat for itself. Whereas the rest of the individuals, their gut environments were obviously not permissive. This is one of 2 studies. Another study did show also that there were responders and non-responders. And they theorized that this was due to a combination of genetics, the immune system, and lifestyle factors. So basically, that's a big answer, hand-waving, saying that they have no idea. So at this point, we do know that there are people who are responsive to probiotics and to healthy people that are responsive and healthy people that are non-responsive. How do you know if you're responsive or unresponsive? It's just a trial and error, and you'd have to take a probiotic and then sample yourself after you discontinue that use. So it's like rolling dice whether or not these probiotics are going to have an impact in colonizing you if you're healthy. And so it's not going to hurt you to take a probiotic, and if it doesn't colonize, it doesn't colonize, but you just might not be reaping any benefits that other individuals might be reaping when they take these probiotics, and they're more of a permissive or responding phenotype. So there's a number of factors that will prevent these probiotics from having any real impact if you're a healthy individual. But who will benefit from probiotics, and what studies are out there that show probiotics do have an impact in health and disease, especially acute and different chronic diseases. Recently, there was a meta-analysis done looking at 52 studies on probiotics, and they found that there are roughly 5 to 10 conditions that benefit from probiotics. Some of these include necrotizing enterocolitis, which is a disease that impacts about 5 to 10% of infants with a low birth weight. It's a very devastating disease that occurs in the intestines of these infants and leads to about 30% mortality. A bunch of randomized clinical trials showed that probiotics could prevent necrotizing enterocolitis in infants. In diabetes, there were randomized clinical trials that have shown that probiotics improved fasting blood glucose and A1C levels in patients with type 2 diabetes. So there's really positive outcome for use of probiotics in diabetes, as well as in treating both infectious diarrhea, also called traveler's diarrhea, which is a disease that's caused mostly by viruses when you travel to other countries, or sometimes it occurs in children here in the United States. specifically Lactobacillus rhamnosus LGG and B. infantis have been shown to reduce the severity of acute diarrhea. Other studies have been more critical of the role of probiotics in infectious diarrhea, so I think maybe the jury's still out on that one. Irritable bowel syndrome is a disease that individuals will suffer from chronic constipation or diarrhea, or a combination of both. It's a very uncomfortable and debilitating disease in these individuals, and so there's been some randomized clinical trials showing that probiotics like Saccharomyces cerevisiae and B. infantis that have been able to reduce symptoms of IBS, and those symptoms include abdominal pain, gas, and constipation. However, some other symptoms were not alleviated by probiotics. So with IBS, it seems that the probiotics treat symptoms and not, they don't prevent disease in any case, but especially bloating and the urgency to use the toilet were not affected by probiotics. So in those cases, in these diseases, probiotics have been shown to have a positive role, and that's probably because there's been some sort of change in the gut microbiome composition that would allow these gut bacteria to come in and to colonize and to have their positive effects. And so these individuals have probably suffered a dysbiosis of their gut microbiome, which is a change in the composition that allows these probiotics to have an effect. Now, antibiotics are something I really briefly wanted to touch upon because people often want to take a probiotic after antibiotics, because antibiotics are meant to kill bacteria and they're like a nuclear bomb in your guts. They're going to kill large portions of your gut microbiome, and so people want to take advantage of that space and like fill it with a probiotic while they can, so help their gut heal after antibiotic use. And that's a great idea. But what research has shown is that taking a probiotic after antibiotic use actually delays the own microbiome from coming back and growing and restoring itself. So probiotics delay that composition and that commensal regrowth of an individual because they're taking up space and they're taking up nutrients. And so they're really going to prevent the regrowth of your own commensal microbiome, and they're going to just delay that. And you don't want that delayed because that leaves you open and susceptible to infections and pathogens that could come in and cause an infection. So the better idea might be to just, after antibiotic use, to just eat healthy, rest, recuperate, and let your own normal microflora grow back at the rate that it needs to grow back at, rather than trying to take a probiotic, which might affect the proportions of the gut microbiome in a negative way. And so here, in summary, I think it's really important to think of that in order for a probiotic to work, there has to be space and availability in your gut and in that ecosystem for the bacteria, the probiotic, to take an effect and to take hold and to colonize and to grow. So there's a lot of reasons why these probiotics have a difficult time in colonizing a healthy individual. And so this is information for you to use next time you're at the store and you want to add a probiotic to your health. Another thing I want to just mention is that there's a lot of companies out there trying to promote healthy living through doing microbiome analyses. So basically sending in a stool sample and they tell you the bacteria that are present in your gut. And after you get the results, they then will want to push their own brands of probiotics. They want to sell you a personalized microbiome or personalized probiotic cocktail that will help your gut environment and gut health. And these more than often are just a sales gimmick. If you're a healthy individual, we know, and I just told you all the reasons why, probiotics have very little consequence to your health if you're somebody who lives a fairly healthy lifestyle. And so any company that's trying to push or promote their own probiotics and supplements, you have to wonder about their motives, because oftentimes these probiotics aren't going to have an effect. And there's really no science out there to indicate whether or not a certain probiotic is better for an individual than another probiotic. We haven't gotten there yet in scientific research, and so companies that are giving you that information, it's not really very accurate. So I think the best idea for people who want to that are healthy, that don't have an acute or chronic disease, the best thing you can do is to continue to eat healthy, to have lots of vegetables, fruits at every meal, to make sure that you have every color of the rainbow on your plate, because all those different colors give you different phytochemicals that feed different bacteria and have different beneficial effects. To exercise, get a good night's sleep, and to make sure that you're just consuming these good healthy foods that feed your gut bacteria. Taking fermented foods that have a rich source of prebiotics, and prebiotics are factors that feed the good bacteria that are already inside you. So if you're healthy and you have probiotic bacteria in your gut, just feed them and nourish them, and what you'll see is you'll feel better, and that will eliminate the need to really be spending time and money trying to find a probiotic that's really right for you. So on that note, I think that does it for me today. So thank you for taking this time to listen to me and to talk to you about probiotics. And until next time, have a good day. Thanks.